starting out with a quick announcement before we dive into today's episode. We are having a free masterclass on January 30th from 12 to 1 Eastern Time, and the topic is Shape Up Your Weekly Executive Team Meetings for a High Impact Year. So, whether you're tackling tough meeting challenges or fine tuning an already strong meeting culture, you're not going to want to miss these 7 game changing tactics. Register today at capstoneleadership.net/upcoming events or email us at info@capstoneleadership.net and we'll send you a registration link, or you'll see it in the show notes below.
This is where organizations stop something because, well, we've been doing it for 6 months. Not everybody's engaged. We need to stop. I think that's the wrong decision. We have to keep going. If you believe that it's right, if you believe that it's achieving your mission, vision, and values, that this is the right thing to do for your patients, your community, and your staff, then you have to stay the course.
Welcome to Culture Change RX, the podcast for healthcare professionals that are committed to creating a thriving workplace culture, improving the experiences of employees and patients, and ultimately unlocking their organization's next level of potential. I'm Sue Tetzloff, your host and co-founder of Capstone Leadership Solutions. Join me and my insightful guests each week as we share actionable insights for navigating the crucial people side of the business of healthcare. Subscribe now for a weekly dose of Culture Change RX. Now let's dive into this week's conversation where culture change takes center stage.
Welcome to another episode of Culture Change RX. This is Sue Tetzloff, the host of the show. And today I have a guest with me, Ben Davis, and he is somebody that's been with us before. So this is Ben's third time on the podcast. We're chronicling his organization's transformation right from the start. And Ben is the CEO, has been willing to have these conversations once a quarter to keep the conversation going and the updates flowing related to his organization and the efforts they're making to serve their community better through the work of their employees and their leaders. So welcome back, Ben. I'll have this first opportunity right at the start for you to introduce yourself for those that haven't met you yet, and then we'll jump in to talk about how things are going there for you.
All right. Thank you, Sue. Again, I'm Ben Davis, President and CEO of Glencoe Regional Health, located in Glencoe, Minnesota. We are a 25-bed critical access hospital with a 108-bed long-term care facility, as well as a 40-apartment independent care facility.
I know, and some people know this, but not everybody knows that at Capstone, most of our work is working with organizations very much like yours in rural communities across the country, most of them in the Midwest. And it's been a pleasure working with you and your team and your leaders over these last months. So we like to update everyone as to how you're approaching this transformation. And really, we say, this is how we team around here, this is how we lead around here, and this is how we change around here. So let's start with the teams and how your teams are doing. So one of the first things we did was help your organization decide what teams we would set up for this initiative. And in particular, most of those are employee-driven teams. So most of the members are employees where they can contribute to top organizational strategies. And your teams have been going for about 2 quarters now, 2 full quarters, getting their action plans done. So I'm curious to know kind of the work they're getting done and also how they're doing being employees on these teams. That's a little different role maybe than they served before. So maybe the work they're doing and how they're working together to do the work. I'm curious about how that's going for you.
Well, I would say overall, very well. I think our team leaders are really starting to hit their stride. And I think just in general, when you start and you bring 10 to 13 frontline staff members together, there's a little bit of uneasiness, I would say, just getting to know the members of the team. But after 6 months, just talking with team leaders last week, they're really excited about the progress that they're seeing. So we went through that first orientation phase with the frontline staff members, and now they're starting to pick up the routine of this, starting to figure out the action plans and really understanding the direction of what we're calling the Experience Initiative.
Yeah, yeah. That's interesting because years ago when I was researching and studying about large scale transformation and in particular using teams, and you learn about how any team working towards anything, how there's this phased approach they go through of, getting to know each other, getting to learn to work together. And so that is a process, and you guys have to get through that process and work through those dynamics of becoming a team. So, really being able to be a team.
Well, and I believe, when you get people together who don't know each other, and we're an organization of over 675 staff. So
Mhm.
we might have somebody in the surgical department that doesn't know anybody in the long-term care facility, right? And
Right.
that happens because we're fairly large campus for a critical access hospital. And so getting them together is it's magical.
Mhm.
The relationships that are being built, and then the communication that flows from place to place when you would know somebody who works there that you might have a question that you can just call them up or ask them, send them an email, and they'll
Yeah.
respond because you already have that relationship.
Yeah, yeah. We realized when we set up our approach to this, and in particular, the employee driven approach with these teams where they're multidisciplinary, where they're really representative of the whole. And we've got people working together that don't normally work together on these teams. And also, even the training approach to the employee training and the leader training, we realized in the pandemic showed us this, that we created a real social model of relationships and getting to know you and getting to work together in these very structured ways that then usually have, just to your point, Ben, of this ripple effect of outside of their work in your experience initiative on these teams or otherwise, it benefits them day to day.
Yeah, absolutely. Yeah, so I'm looking forward to the continued building of those relationships over time.
Mhm. Have you had a lot of turnover on the teams? Like the people that when we set these up in the beginning, it was really a process to make these diverse groups of teams with people that were passionate about the purpose of each of the teams. And sometimes, especially in that first 6 months or 12 months, there's an opportunity for people to say, this isn't for me. It wasn't what I thought it was going to be, or somehow it's just not working out. Have you seen a lot of turnover in team membership at this point?
At this point, we have not. Primarily, I do think, we have strong team leaders who are educating and lifting up our teams, right? And getting them in the mindset of what the teams are about and what is possible to achieve. And actually, we've had staff that aren't on the teams asked to be on the teams.
That's a
So
good thing.
yeah, it's been great. And we were very diligent about who we selected to be on the teams in the first place. So those were people who we felt would be engaging, who were forward thinking and looking at the possibilities for the future.
Yeah. And my experience, not just with your organization, but even in my own organization where we had a similar journey with similar teams, is you got to keep the day job going, right? You got to keep the work going. And there can be ebb and flow to that. You can have certain team members that are working in departments that are seeing a surge in volumes. We saw this during the pandemic, right? And so it can be one of the major challenges to this approach is we're small organizations without deep benches within our departments, and one person leaving their department to go to a meeting for an hour can be challenging. And so you don't just need the employees' willingness, you need their whole department and their leaders' willingness to let them go there and support them in going there to really be part of this initiative. And so even if you're not on a team, you're supporting the team in this work when you're supporting those members getting to their meetings and doing the work of their team.
Yeah, and that has been a challenge primarily because we have seen more patients coming through the door, more residents coming through the door and staying and getting services here. And so that has been a barrier. Now, I will say we've had pretty great participation overall from what I'm hearing from our team leaders.
Great, great. Yeah. See, one of your goals of your organization and a top strategic priority was to improve access. So it sounds like you are. It sounds like somehow people are accessing you more.
Yeah, we've evolved and there's still a lot more work to do, but we're moving in the right direction.
Oh, that's awesome. Yeah, we do. love watching our partners improve and grow. It is change and it is work, but it's fun, good work. It's very purposeful. Anything else you want to mention about how the teams are going at this point of the initiative?
Well, I would say it's almost like we're succession planning as well as we're growing
Oh,
leaders as these team members. They're growing, they're learning how to run meetings, and actually they're creating their own subcommittees within the teams and without the team leader being there. Right. So you've got this informal leader leading a group of other, go-getters to create, and make recommendations to the team to move forward. So it makes sense, and it's really investing in your staff. It really is a
yeah.
great investment.
Yeah. Yeah. That's such a good point. And thanks for mentioning that, because you always wonder what's the return on investment of this. And, definitely the improvements that they make for the organization that are top priority and strategic, or else the team wouldn't exist to do the work. That's certainly a win. But these other things, like we talked about, the relationships that are forming that helps with day-to-day operations across departments and silos and the like, but then also the succession planning and the development of our employees for maybe other future roles. So lots of goodness there. So thanks for bringing that one up. Let's switch to leaders. So when we spoke last time in September, you had just come off your 2-day leadership immersion. For those that are listening that don't know what that is, it's 2 days of having their leaders all together to learn what we would call the leadership bundle, 9 core leadership practices. And it's a way of just introducing core leadership practices to all of the leaders all at once, the what, why, and how of it, before they move into really starting to get more consistent and competent in each one of the practices over time. So it's kind of like the getting started piece of the leadership practices. And so you're a few months post that now. What are you seeing with your leadership team in these past months?
Well, I would say growth, especially the team leaders, the leaders that are on, and we have
Mhm.
some co-leaders on teams, which has been helpful when there's vacations and those and scheduling, and also to
Real
moving
life.
forward. Yeah, real life happens. So that has been good. And then we identified peer champions, and that was a little bit. There were some that jumped on it right away, and then there were others that weren't quite sure about, well, what am I really signing myself up for? And, we have a huddle every morning, and some of the peer champions have stepped up and just talked about what they've learned in their peer champion education. And to see that growth, to being willing to speak publicly about the experience initiative, about their bundle specifically, it's just great growth opportunities for our leaders. So I'm excited to see that.
Mhm.
And then also, I think our leaders are starting to see the value in what we're doing. And we set organizational wide goals. We've set department goals and team goals, which we typically hadn't done in this
Mhm.
organization. And so this is new. It's new. It says, as we talk about change management, right? We're all on different levels from time to time on where we're at in that scale. So
Mhm.
we're moving in that direction, which will take some time.
Yeah, the goal cycle, or setting and achieving goals, is one of the 9 core leadership practices. And it's one of those that, in particular, like many of the things we'll say, make each one better than anyone before. So each annual goal cycle, make it better than anyone before. But the early ones, they're not going to be as great as the ones in the future, but you got to start, and you've started. Congratulations, you've started. And it will get to a point, and it will get to a point where you can't even remember not doing it. Right now, you can remember you didn't do it, but there'll become a point that, yourself included, will say, gosh, I can't even remember that we used to not do that. It's just part of who we are, what we do. And the employees, the leaders, everyone will know their role in it. It's a really important system for organizations to always improve and grow. And yeah, it's an important one. And I'm so glad you've got some good starts. You've really done some good work to start.
Well, thank you. It wasn't without challenges, right?
Yeah.
I think for those listening, there are certainly challenges. There are certainly leaders and who are wondering, is this the flavor of the month? Is
Mhm.
this will be the flavor of the month? And you just have to commit. It's the right thing to do for the organization. It's the right thing to do for the community. And it's the right thing to do for your staff, to invest in them, to be supportive, to give them the tools to be successful.
Yeah. And how amazing for your organization to invest in your leaders in this way. I know when I was a senior leader and I might be, wishing and wanting my frontline leaders to, do more of this or do this differently or whatever. And I had all these ideas or thoughts about their role and their performance of their role. And, really until we really got committed to developing them and saying, this is how leaders lead around here, and then investing in that, we could wish and want all we want. And it likely wasn't going to change. Some leaders on their own would independently and autonomously get advanced education or degrees or go to conferences or read books or whatever. But then we have variation. This leader learned this and this one learned that and this one learned that. And, that doesn't really help you out synergistically. And so it is quite an investment of an organization to say, we are going to adopt a leadership model and we're going to onboard and train our leaders in that model. And again, just like your goal cycle is part of that model, you've taken those early steps to commit to that and invest in it and take some action that's starting to make some difference.
Yeah, certainly. It's been fun to see.
Yeah. Yeah. Now, one of the things that we put on the action plan of our partners that's ongoing thing is to also not just your leadership group as a whole, that's both your frontline and senior leaders, and have a systematic process and a model for developing the leaders, but also a little special attention to senior leadership and the importance of the senior leadership team. I think probably at this point, you're at the point where that has started as well, where you really work on what are some of the specific things related to the senior leadership team. So that process has started for you, Ben?
So we actually on Tuesday have had a conversation about developing that plan. So we're developing that plan for 2025. We put a group together of senior team members, just a few of us, to bring forward recommendations about what we do for 2025.
Yeah.
I was excited to be able to partner with our senior team to be able to go through these strengthening exercises. That's on our action plan, strengthening, senior team strengthening. And again, that's not something that we're very diligent about, because we get caught in the whirlwind and we're always talking about work and
Yeah.
what's next and how do we achieve this, or how do we get through the day. To take a step back and talk about how we as a senior team connect, how important it is for us to be on the same page and to work in a productive environment. I think it'll only be beneficial for us in the future.
Yeah. Yeah. We like to say when you strengthen the leadership team, you're strengthening the organization. All these other things we're doing is meant to strengthen the organization too. But, to your point, and it's a good one, it also applies to those teams that we were talking about, those employee teams. We have them do an evaluation process of their team dynamics. How is their group working together to do the work? And sometimes we don't take pause when we're gathered together as a team, whether that's an employee driven team as part of this initiative, or like your senior leadership team, where we actually take pause and put on the agenda to talk about us as a team and how we're doing. And if we do that and we can improve that, use that time and energy to improve our team, then all that other work we're doing when we're meeting in the future might get easier and better and more effective. And so it's a kind of a investment in your team as well, but you got to invest time to maybe save time or get better as a team. And sometimes we don't have to, we have to think about taking time for that. And so, yeah, I'm glad you're taking time for that.
Yeah, I'm looking forward to it.
Yeah, yeah. I've been as an insider on a senior team for over 22 years. I served on various senior leadership teams, and we can always work on that. No matter how good you get as a team, I think it's one of those things that you're never done working on being a team. I guess, sporting teams do that, right? They're always working on being a team. So,
Yeah. Well,
yeah.
I think it's also helpful to know that, the whirlwind hits us all differently. And so a solid team, when someone's down or going through a difficult situation, that we help lift them up
Mm-hmm.
during that time. And so as if we're a strong team, we're more apt to do that and more likely to be effective.
Yeah, yeah. And that's an important gathering, that senior leadership team. It's not the only important team in your building, but it's a very important team, and it's worth investing in. And there's a lot of stressors there. There's often a lot of big personalities there. I know that to be true from my experience. That's who rises up to sit in those seats and do those roles. Yeah, yeah. So before we jumped on today's podcast, we started talking a little bit about change, and you shared with me a diagram that I hand wrote about diffusion. It's a diffusion curve, how people or groups of people go through the change process, and you mentioned the phrase flavor of the month, how we start, stop, or, we give up on things before they get to a point where the change is adopted by the majority, where people are more competent and consistent, where it's just the new, better way that just like the goal cycle, we can't even imagine that we didn't have it. That's a process to get there as an organization. Can you speak at all to what you're seeing as far as your organization moving through the process of change?
Yeah, well, this is change management is so important to any initiative and to any organization that wants to adapt to the outside world and things that are happening. As part of the graph or the diagram, you have your innovators, right? The 2.5% that start something. Then you have your early adopters, about
And God
13.5%.
love them, right? Like we need them.
Yeah. And then you have the early majority, and then which you get about 50% of the team, and then you have the late majority, and then you have 16% in laggards, right? And that will take maybe a lot longer than you want to get there. Our team had a conversation about the frontline staff involvement, and we've had our commitment event. We had that in October for frontline staff, so all frontline staff, and we continue to communicate, but we really aren't. We're not even at 50% yet. We're 6 months in. We're probably at 15%, right?
That's a good number, though.
It,
That's a
well, and
good
that's.
number.
But just think that this is where organizations stop something because, well, we've been doing it for 6 months. Not everybody's engaged. We need to stop. I think that's the wrong decision. We have to keep going. If you believe that it's right, if you believe that it's achieving your mission, vision, and values, that this is the right thing to do for your patients, your community, and your staff,
Mm-hmm.
then you have to stay the course and commit. So that was my communication and conversation and discussion with our leaders as well as our board, just to say this is how we're going, and to get their commitment as well, that
Mm-hmm.
this is a great direction. This is the right
Mm-hmm.
thing to do. But we have to stay the course because change management does take time.
Mm-hmm. Yeah, yeah. I use the example. I snuck into a physician education with my husband, who's a doctor, and he was at a CME. And you could bring spouses or guests into the sessions. And instead of sitting by the poolside, I snuck in with him there and sat next to him during a session where they were talking about when a doctor learns research about a new, better way to take care of a patient, like congestive heart failure or something. Is, they go to the CME, they learn it, they go back to their office. And once that research is out there and it's published and it's presented at training, it can be upwards of 15 years before it's the majority, like more than 50%. And these are smart people. It's not about smarts. It's not about caring to do the very best for your patients, because they do. It's just the human condition that we've always done it this way. I've been taking care of congestive heart failure patients this way for the last 10 years, and I think it's working for my patients. So I'm not really, wanting to change it, even though I just saw this evidence or even though I just learned this new thing. And I find that fascinating that as humans, and sometimes when we want it ourselves, like I love to use examples of myself where I, wanted a change. I maybe invested in a change for myself, and then I too give up on it before it's very far, or I struggle with it and I chose it and I invested in it and I wanted it and I'm smart and I'm motivated. But it's just an interesting brain we have.
I agree. And I also think there are those who want to see hard and fast metrics and numbers that say, hey, we're moving there. Because right now we don't have that. We're developing our data. We've got our goals for 2025. We're going to report those quarterly. So we're not going to see those clear metrics until April of 2025. So we're asking people to believe, without any hard facts. And that will take time. And so for understanding that, for those that really need to see clear evidence, we'll get there, but that will take time.
Yeah, it's like being on a diet, right? Let's say I have a new eating plan and a new exercise regimen, and I say I'm not going to weigh myself until April, right? I'm not going to weigh myself till April. But the nice thing about that though, Ben, is if you're actually doing it the new better way, you're going to know it's working before you step on that scale in April, right? You're going to know it because you're going to feel it in your clothes, in your body, in your mood, in your energy. You're going to feel it. The subjective findings, fortunately, are also there for you. It'll be palpable. You'll be able to tell that it's working. Yeah, that's the good part. While you
Yeah,
wait on the numbers. Now I'm a numbers geek. I love the numbers, Ben, and I can't wait to see your numbers moving in the right direction.
oh yeah, and I have no doubt that they will. But again, there are those that really want to see that and
I
want to see the information in front of
don't
them.
blame them.
It's understandable. Yeah.
Yep. Yep. And when you're promoting change, you got to go after people's head and their heart. And the head part really is about the data and the evidence, right? And some people are more compelled to be, motivated by the data and the evidence. And others are going to be more like, this is the better way. It feels better to me. It feels right. It feels kinder. It feels, like the right thing. And so, you have both in your mix, and some people are a mix of both. Yeah, you have to approach it that way, but data is important and it tells us two things. Is it working? And also, what do we need to work on next? So data is going to be really an important part of this, and it's going to be fun to watch your data as far as I'm concerned, because I love data.
Yeah, I'm with you. I love data, and that's us just making sure we have the right data in place,
Yeah.
consistent data, and at the start, and go from there.
Mhm. Yeah. Yeah. And you got to collect that baseline. I mean, a lot of times when we're starting with the organization, they need to shore up some of their baseline metrics. They might have way too much data, not know what to, razor in on, or they might be missing important pieces of data that's needed. I know in my organization, when we started our organized transformation initiative, for instance, we had lots of patient satisfaction data. We had years of trends. We had annual employee surveys. We had years of trends. But what we didn't have was years of action plans that had been developed and implemented consistently over time. So we had all this data and information, but we, hadn't done anything with it. But then it was fun to watch that when we started to make some changes and implement some action plans, to be able to then watch the response of the data, where before the data was just happening. I mean, we weren't really doing anything to change it, good or bad or anything. It just was what it was. So it's fun to see that you can actually control the data to some extent.
Yeah, I agree. And the other thing, I think people can see it because of all of the things that we've already instituted, like monthly accountability meetings, staff meeting models, communication guidelines. Now, we've had great communication, I think, within an organization, but we didn't necessarily tell staff, this is how we're going to communicate to you. We're actually paying really close attention to our employee engagement survey and getting many people's eyes on it. And so those things we've been talking about, but we never got to them.
Mhm.
Right now, we're just doing them. And
I
so
know.
I think we're seeing progress because things are happening, which in the past we were just we were in the whirlwind.
Mm-hmm. Yeah. Like I hear some people say, we now have a method to our madness.
Yeah, definitely.
There's still madness around us, right? But we have a method to our madness now.
Yeah. Well, and it's structured. It is
Yeah.
really structured. We were talking the other day about the goal setting and then implementing, for instance, our communication guide and staff meeting models. Well, how do we communicate that to our teams? And that's through our staff meetings, right? We have now a way which staff meetings were happening, but we didn't have a structured where many departments were doing it in a similar way or a standard of work around
Uh-huh. Yeah.
on staff meeting models. But now we do to facilitate that communication throughout the organization.
Yeah, yeah. I think that leaders that were having staff meeting without the standard work, they're doing it the way they thought was best. Or that somebody like who had the job before them told them, this is how I do a staff meeting. They thought that was the way. And they might not know that there's maybe a better way, or if we're all consistent in our way, that's going to be better overall for the organization. And so it is, each one of those are an opportunity to make a compounding kind of effect that you wouldn't get otherwise if everyone was just doing it their own way.
Yeah, absolutely.
Yeah.
Absolutely.
And it sets your leaders up for success too, that they don't have to figure it out on their own. They don't have to struggle any more than they have to. Teach me, develop me, show me the way. And that makes it easier for me, not more for me or harder for me.
Yeah. I had a mentor that said, create an environment where your teams can be successful. And that is by giving them the tools and creating the environment where they can be the best that they can be.
Mm-hmm.
And I truly believe in that is our responsibility as leaders, is to give the tools and help guide our leaders and staff so that they can take care of our patients and
Mm-hmm.
residents in the most effective manner.
Yeah, yeah. And that is where the rubber meets the road. So it's fun to watch your organization organizing its effort to do that better and better over time and to continually improve and grow to serve your mission and your community. As we wrap up today, is there any last minute updates or advice that you want to share with the world out there before we do this again in a quarter, which goes by so fast?
I think the last couple things I'd say is I'm just proud and honored to be part of this organization and for the organization to believe in this. And also that the providers, we've got providers on our teams and their engagement. So one of our teams is around access. We're trying to create access in certain areas of our organization, and their insight to have that support from providers is really key. And again, they're not always able to be there,
Mm-hmm.
be with the teams, but they are part of the solution as well.
Mm,
And then I
good.
think for anybody thinking about starting this journey is, if you're going to do it, you have to commit and you have to believe that this is the right thing to do. As I stated previously, it's
Mm-hmm.
really fun to see the growth. And I think sometimes as leaders, we feel like we can just do it alone. If I'm the CEO of the organization, I could probably just do this. The reality is there's too much going on a day-to-day basis, and actually your teams need you there to support them within the whirlwind and coaching and lead this initiative forward. So I would share that.
Yeah,
It just makes me so happy to be a part of it, and that we found you,
yeah,
Sue,
yeah.
and that you and your team have been phenomenal.
Thank you. Thank you. We love this work. We have one major goal, get great results for partners. And we're your guide. You're the hero. You're the one doing it every day. We're your guide. And we love being your guide in this. And yeah, your wins feel like our wins. So we're so proud of you as well. And that's such great advice, Ben, is that, commitment is required, because just what you mentioned earlier is you can be stopped at any point in that change process. And it is easy to see the struggles and the barriers and think it's a sign to give up and to stop. And when you're committed to getting to the other side, then you persevere and you grow and you flourish. And, a lot of good things happen on the other side of that. So, but it is a process and it does take commitment.
Well,
It does.
and plan, do, study, adjust.
I know.
Right? It doesn't.
Sounds simple, doesn't it?
Well, if it's not working the way that you want it to, there are ways to adjust and
I know.
adapt
Yeah.
to things that are going on.
Yeah, yeah. And, it's such a lesson too to not try to get it perfect right out of the gate, because that just takes too much time and effort. And you're probably going to be wrong, even with all that extra time and effort. So get it to a point of launch and go. And you can always circle back to it and study adjust. And you should anyway. I mean, to get through that adoption curve, you're going to need to do that anyway. So yeah, it's never one and done. Plan, do, study, adjust. Plan, do, study, adjust. Yeah.
Yeah, it's easy to get into analysis paralysis. I think this gives you an opportunity. The plan, do, study, adjust process gives you the opportunity to adapt, right?
Yeah. Yeah. It is amazing to watch those light bulbs come on and that they actually live this process out. And yeah, so here we go. Plan, do, study, adjust. We'll keep on going. And next quarter, we'll come back and check in and see how that's going for you.
That sounds great.
Great. Thank you again, Ben, for your update and your willingness to share these updates on a regular basis. Thank you.
Thanks for having me.
Thanks for tuning in to Culture Change RX. If you found value in today's episode and you are a believer in fostering change in healthcare, join us in making a difference. Follow, rate, and review our podcast on your favorite platform. Share it with colleagues and your network. Together, we can make a lasting impact. Until next week, keep inspiring positive change.